Newcastle disease is one of the most common viral diseases of poultry with high economic importance and is distributed worldwide. Chickens and turkeys are particularly susceptible, showing morbidity and mortality rates up to 100%. Newcastle disease is caused by avian paramyxovirus type 1, also called Newcastle disease viruses. Its strains serologically belong to one serotype, but they are classified according to virulence into three pathotypes. Lentogenic strains are the least virulent, mesogenic strains are moderately virulent, and velogenic strains are the most virulent. Velogenic viruses can be subdivided into a neurotropic form and a viscerotropic form. Newcastle disease virus can be transmitted by inhalation or ingestion. Birds shed the virus in both feces and respiratory secretions. Waterfowl may act as reservoir hosts for the Newcastle disease virus. The incubation period is relatively long. It varies from 6 to 11 days, depending on the virulence of the strain and the susceptibility of birds. The clinical signs vary with the pathogenicity of the isolate and the species of bird. Velogenic strains cause severe, often fatal disease in chickens. Most birds are depressed and off food, with ruffled feathers, especially in feathers of the neck, edema, and redness of the conjunctiva. Watery, greenish, or white diarrhea, respiratory signs, and swelling of the head can also be observed. Neurologic signs including tremors, paresis or paralysis of the wings and/or legs, and torticollis may occur. Egg production in laying hens often declines dramatically, and eggs may be misshapen, abnormally colored, and rough or thin-shelled. Sudden death, with few or no symptoms, is also common. The symptoms may be less severe in vaccinated birds. Newcastle disease is generally milder in turkeys than chickens. Post-mortem lesions include swelling of the head or periorbital region, congestion and hemorrhage of the trachea and esophagus. Petechial hemorrhage in the proventriculus, hemorrhages, ulcers, edema, and or necrosis in cecal tonsils. Hemorrhages in thymus and bursa may also be present. The spleen may be enlarged, friable, and dark red or mottled. The ovaries are often edematous or degenerated and may contain hemorrhages. History of the disease, clinical signs, and post-mortem lesions may help in the diagnosis of Newcastle disease. Confirmed diagnosis is obtained by laboratory tests including hemagglutination inhibition test, isolation and identification, and PCR. Prevention and control of Newcastle disease depend on good biosecurity and vaccination. Vaccination against Newcastle disease may be done by living attenuated vaccines, inactivated vaccines, and/or vector vaccines. Living vaccines include La Sota, most immunogenic, B1, and Cologne. They can be applied by drinking water, spray, or eye drop. Inactivated vaccines can be applied by subcutaneous or intramuscular injection. Vector vaccines are applied at 1 day old in the hatchery by subcutaneous injection. To deal with Newcastle disease, reduce the spread of infection by using disinfectants in drinking water and spray. Increase the immunity of birds by administration of immune stimulants and what is called virus inhibitor or antiviral. Supportive treatment involves using general tonics, renal wash, and hepatic tonic. Thank you.